A clinical workflow is the process of evaluating the patient experience from the time they check in to the time that they check out. We conduct clinical workflows at least twice annually. We look at the time that the patient checks in to the time the patient checks in with the nurse, and then from the time that the patient checks in to the nurse to the time that they check out. By understanding those times, we are able to break down what issues may be causing bottlenecks, and we are therefore able to improve the efficiency of their cycle time. It's broken down with the quality teams per site, and then we have 2 teams at our Lugoff site because that's our bigger site. And each team is made up of a provider, nursing staff, pharmacy staff, front desk staff. So all of our frontline staff members are involved in understanding what the quality initiatives are and what we need to do to be able to achieve them. So they all have their own individual measure that they are responsible for working toward improving. So that gives them hands-on responsibility for quality improvement at St. Hills as a whole. So we have those type of teams at all of our sites. Our CQI minutes are maintained by our CQI nurse, and she establishes action plans. And on the action plans, it has who's responsible for what particular action and when it's due by. And every meeting, we revisit those action plans and see have they been done. We use Allscripts, and our population management team does monthly reports on selected quality measures and provides those reports to our providers every month. So providers are able to track how they're doing every month, and then they take that information back to their nursing staff, and then they begin working together to see how they can further improve those areas. We standardize the workflow process by developing procedures that we expect all of our sites to follow. Our COO, once he completes his workflow studies, will then submit the reports to the front desk manager as well as the director of nursing to give a report as to whether employees are following those procedures.